Hello, I'm Keith Kesler, psychiatrist and psychoanalyst in Austin, Texas. Today what I want to do is continue with this series of videos about inflammation and ultimately its effect on the brain. But today what I'm going to do is to give an overview of inflammation, its benefits, and its problems, what it looks like, what to pay attention to, and ultimately, by the end of this video series, what to do to decrease the overall inflammation in our bodies. Inflammation is the body's response to a number of things. It's a response to infection, such as bacteria, viruses, and parasites. We see inflammation with injury, such as a sprain of the ankle, hitting our head, or even a sunburn. Chronic stress, such as persistent worry, grief, what we see with soldiers and victims of violence, have increased markers of inflammation. We see inflammation as a response to toxins, such as pollution of air and water. Plastics within the environment can lead to an increase in inflammation within breast and prostate tissue, even leading to cancers. Another example is lead ingested by children, leading to inflammation of the brain. Finally, heavy metals within the environment can cause an inflammatory response and even cancers of the blood. Inflammation is a response to irritants, such as pollens, dust, fumes from paint or solvents that lead to inflammation of the respiratory system. Finally, certain foods can cause an inflammatory reaction. We see this with gluten, so-called celiac disease, in which people are allergic to the protein within wheat. And peanuts are a well-known food allergy. So, what function does inflammation serve? Ultimately, it's the body's attempt at self-protection, the aim being to remove harmful stimuli, including damaged cells, irritants, or pathogens, and ultimately to begin the healing process. It's there to repair injuries, by repairing collagen, the connective tissue, revitalizing cells, eliminating aged and damaged cells, giving us immunity, and providing scar tissue to strengthen damaged skin, muscles, and organs. It is a protection from invasion. And in this next slide, I'm going to show you the mechanics of how the body at the level of the cells protects us, providing immunity and taking away invaders. There's a lot here in this, so bear with me. To the right, we see that there's a wound with bacteria or other particles. The platelets, the blood platelets, release a blood clotting protein into the wound. These mast cells that are green, they're a type of white blood cell, they secrete a chemical that causes dilation of the blood vessels and delivers blood and cells to the injured area. Neutrophils, blue in this diagram, are again another type of white blood cell, and they secrete factors that kill bacteria or other particles that invade the wound. Macrophages, these purple cells, so-called big eaters, hence the name, secrete hormones called cytokines that attract the immune system cells and activate tissue repair. The neutrophils and the macrophages engulf or eat up the particles, removing them from the wound. And then this inflammatory response continues until the particle is eliminated and the wound is repaired. A nonspecific reaction to inflammation that's mediated by these pro-inflammatory agents causes a so-called sickness behavior. This is a good model for us to see the effect of inflammation on the brain. So go back and think of the last cold, flu, or illness that you had. There was generalized weakness and malaise, a lack of energy, fatigue, withdrawal, wanting to hide out in the bed, felt very sleepy, poor concentration and poor focus, no appetite, and achiness and pain. So again, with sickness behavior, that is weakness, lack of energy, fatigue, sleepiness, poor concentration, no appetite, and pain, causes us to stay withdrawn and in bed to ultimately take care of ourselves. But it's a nonspecific response to these hormones called cytokines that we also see with major depression. Many of these symptoms on this list of sickness behavior are the same symptoms that we see with major depression. So what does inflammation look like? It's important to differentiate between screaming and silent types of inflammation. The screaming inflammation we see with such diseases as bronchitis, an infected ingrown toenail, sore throat, a cut or a scratch, an acute appendicitis, or a blow to the head. It's characterized by pain due to chemicals being released by the damaged cells, by swelling, again, chemicals being released by the cells causing a permeability or a leaking of the blood vessels. Redness from the vasodilatation, that is, the blood vessels widen and there's more blood and fluid into the area. Increased heat because of that increase in blood flow. And finally, loss of function because of the swelling and the pain. And so next we're going to look at silent inflammation. This one will kill you. The chronic and continuous low-level stress that silent inflammation places on the body's defense systems often results in an immune system breakdown. It's important to know that silent inflammation is below the perception of pain. Unlike screaming inflammation, where we have a blow or an injury to the tissue with a release of chemicals that cause this painful stimuli, silent inflammation does not affect us that way. It's at the level of the cells, compromising the internal function of the cells. It causes a breakdown in the signaling between each cell and seems to be the major cause of cardiac disease by damaging the lining of the blood vessels, many cancers, and brain disorders such as Alzheimer's, depression, and anxiety. I know there's been a lot of information here, so bear with me. Ultimately, the inflammation is regulated and caused by the release of these hormones called cytokines, in addition to 2 or 3 other major types of hormones. Cytokines are proteins that regulate the survival, the proliferation of cells, and the function of tissue and cells, giving us immunity. But high levels of cytokines within the brain can interfere with normal neurotransmitter function, including a decrease in the amount of serotonin, which is a necessary neurotransmitter in the brain to help regulate mood. Finally, cytokines seem to have direct effects on the body's ability to regulate insulin, blood sugars, and triglycerides, leading to diabetes and other degenerative diseases. So here's a diagram showing specifically where the brain is affected by inflammation. Inflammatory hormones, particularly the cytokines, seem to affect the mood centers of the brain, such as the hypothalamus and the amygdala. As a reminder, the so-called sickness behavior is seen with generalized inflammation and is identical to what we see with major depression. Again, this is evidence of the effect of inflammation on brain functioning. So in review, we've seen inflammation as the body's reaction to a number of noxious stimuli, including infection, injury. We've looked at sickness behavior and its parallel to symptoms of major depression. We've seen what inflammation looks like, including screaming versus silent types of inflammation. And then finally, the role of inflammatory hormones called cytokines in both mood disorders and in chronic silent inflammation. In upcoming videos, I'm going to continue by talking about the role of inflammation in chronic illness, what it is that causes chronic, that is silent inflammation, the connection between inflammation and depression, metabolic syndrome, which again is an epidemic plaguing the United States, metabolic syndrome and its role in psychiatric illnesses, an anti-inflammatory diet, and ultimately what we can do to eliminate chronic inflammation. Thanks a lot for listening. Go down below this video and let me know what you thought of this presentation and give me some ideas of what you'd like to hear about. Thank you very much and take care.